student nurse practitioner. How are you doing today?
I'm okay, thank you.
How would you like me to address you?
Jenny is fine.
Jenny? Okay. All right, nice to meet you, Jenny.
Nice to meet you.
So what brings you to the clinic today?
Well, I just been having a little bit of, I guess, confusion over the last several months.
Okay, all right. It happened over the last several months. Have you been having trouble, what kind of confusion? Have you been having trouble with names, with where you put things?
Yeah, sometimes I have a hard time recalling somebody's name that I've known for a long time, or when I'm talking to somebody, just difficulty finding the right words to express myself.
Okay. What about, is there anything that worries you about this confusion?
Well, I have been worried lately about the ability of, I take care of my elderly mother. She has Alzheimer's, so I've been worried about this confusion and how it affects the way I care for my mother.
Okay. Do you run errands by yourself?
Yes, and sometimes I'm driving along, like yesterday, I was going, I couldn't remember, was I going to the grocery store or was I driving to my daughter's home?
Oh, I see. Have you been feeling like you've been forgetting anything else? Like where you are, or if you've already eaten or taken your medications, anything like that?
Well, sometimes I do forget to take my medications on time, and sometimes I'll walk into the kitchen and think, why did I walk in here?
Okay. So, does it feel like it gets worse or better at any time of the day?
As the day goes on, it gets worse.
Okay. How's your sleeping habits at the end of the day?
Well, I'm pretty tired by the end of the day, but then when I go to bed, I have difficulty sleeping.
And do you feel like anything improves the confusion? Anything makes it better at all?
The only thing that has helped is setting a timer to take my medication.
Okay. Do you feel like, this is affecting their ability to care not only for your mother, but your family?
I do.
Okay. So you mentioned setting an alarm for medications. Let's go to that. In your chart here, it says that you take lisinopril, hydrochlorothiazide, and Tylenol. Do you take anything else? Anything additional? No. And then it also says here that you have no allergies. Is that correct?
No drug allergies.
Okay, and nothing no allergies in the environment, any seasonal allergies?
No.
And nothing to latex?
Nothing.
Okay. So this medication that you're on, do you feel like it's controlling your hypertension well?
I do.
Okay. And headaches. You mentioned you're taking Tylenol for headaches. Do you feel like you're having a headache now at all?
No.
No headache? Okay, good. Also in your chart, I'm looking in here, and it says that your mother, you're taking care of your mother now, correct? Okay. It says here that she's 92 and has Alzheimer's disease?
Yeah.
Okay. She also has hypertension and high cholesterol?
Yeah.
Okay. And your father, he died at 52 of a stroke?
Yeah.
Okay. Your son has hypertension and is 40? And your daughter is 38 and she's in general good health?
Yeah.
Okay. All right, good. I'm glad. Anything changed in your family history department?
No.
Okay. Now, you live with your mother that you're taking care of. Do you live with anybody else at home?
Yes, my husband. We've been married for 30 years, and then my mother and our two not our two children, but just my husband and my mother.
All right. Do your two children come over and help out at all?
I've kind of been doing this on my own.
Okay. All right. Has your husband helped out at all?
No, he's busy. He works a lot.
How would you say your relationship is with your husband?
I would say that it has changed a little bit. We don't have a lot of privacy now.
Okay. Do you feel any changes in your sexual health at all in the relationship?
I just been so tired that I haven't wanted to have any sexual activity.
Okay. When you do you use any forms of birth control?
No.
No. Have you had menopause yet?
Yes.
Okay. Has it been over a year that you've had menopause?
Yes.
Okay. So your last menstrual period was over a year ago?
Correct.
Okay. And it says here you were working as a bookkeeper. Are you still working as a bookkeeper?
No, I retired 2 years ago.
Oh, good for you. What have you been doing in the meantime besides caring for your mother? Have you done anything?
Well, I've been taking care of my mother full time. I usually spend my extra time reading, but I just really haven't been able to enjoy that because I haven't been able to concentrate, and there's just a lack of free time.
Okay. Do you smoke?
Nope.
Do you use any alcohol?
No.
What about any recreational drugs like marijuana, heroin, cocaine, anything like that? Okay. So I just want to go over just your review of some systems here. Okay. Have you fallen at all?
No.
At home? No. Have you fallen and have you hit your head on anything? Not just necessarily falling, but maybe something fell on your head
No.
or banged your head? No. Any recent weight loss or weight gain?
No.
Okay. What about any sort of infections? Have you been sick lately?
No.
No. Any dizziness?
No.
Lightheadedness? Nothing like that? What about, have you been feeling faint? Have you blacked out at all? No. What about, people? Like your husband, your children, your mother, have you been able to recognize them?
Yes.
Okay. What about where you are? You say sometimes you walk into the kitchen and you're, confused. Why did you walk in there? Do you recognize that is a kitchen?
Yes.
Okay. What about things? Are you able to recognize this?
Yes.
Okay. What is this called?
Pen.
Okay. So you have, you said that, when you see people, sometimes you forget what their name is. And what about finding words to express how you feel? Do you have any difficulty with that?
Yes.
Okay. And you say you forget when you need to take medication, so you set the alarm. That's a very good thing. And where you're going, you say you forget where you're going sometimes. And sleeping, you say you're having a little bit difficulty with sleeping too. Okay. Are you taking anything to help you sleep at all? Any nighttime aids?
No.
No? Okay. All right. So what I want to do right now is I just want to look you over.
Okay.
Do a physical exam. I see the medical examiner was in here and grabbed your vital signs.
Okay.
Everything looks pretty good with that. Also, when she was checking you in, she gave you a mini mental state exam, and that score was 26. So it's okay. Also, gave you a screening test on the instrumental activities of daily living, and gave you a questionnaire. And the questionnaire, I looked that over, it was negative.
Okay.
So that's okay. So what I'll have you do is I'll have you hop on the exam table, and then I'll give you a look over, okay?
Okay.
All right. Clean my hands again here. So normally we would have you in a patient gown.
Yeah.
Unfortunately, we don't have those today. I apologize for that.
Okay.
So what I'm going to have you do is I'm going to have you look at your eyes here. Let me grab this. First what I'm going to do is I'm going to have you just look straight ahead, and I'm going to look at your pupils, okay? All right, can you look at my finger? Can you look at the wall? Look at my finger? All right, good. I'm just going to look in your eyes, okay? Get the kind of light that I want, okay? I'm just going to look in. Just look straight ahead, okay? Good. All right, put this back over here. And then what I want you to do is just look at my finger, okay? And don't move your head at all, just follow my finger, okay? Any eye pain or anything like that?
No.
No? Okay. Next, what I'm going to have you do is I'm going to look in your ears. Make sure that nothing's going on in there. Do your ears bother you at all? Are you having any ear pain?
No.
No? Okay. And if you have any questions at any time, please, stop me and ask.
Okay.
All right, so I'm just going to look in your ear. Am I hurting you at all?
No.
Look in your other ear. You tell me if I am, okay?
Okay.
Great, yours is good. And will you open your mouth for me? Say ah, stick your tongue out. Say ah. All right, good. That. Okay. And I'm going to check out your neck here. Clean your hands. Any pain at all over here?
No.
Can I touch your neck? No. Can you turn your head to the side? To the right side, good. And swallow. And then turn your head to the left side. Swallow. All right, good. Any pain in your neck at all when you move?
No.
No. Can you lift your shoulders for me? Good. Can you puff out your cheeks? Can you lift your eyebrows? Good. Can you put your shoulder to your shoulder to your ear, ear to your shoulder? Okay. All right. I'm going to take a listen to you too. I'm going to listen to your lungs, okay? Every time you feel the stethoscope touch your skin, take a nice deep breath in and out, okay? Deep breath in. Now listen to your front here. Deep breath in and out. Good. And I'm going to listen to your heart, okay? So you can breathe normally when I'm listening to your heart. Just going to listen with the other side of the stethoscope. Any chest pain at all?
No.
No? Just going to listen to the arteries in your neck, okay? Okay. All right. I just want to check your strength here really quick too, okay? Can you push out towards my hands? Good. Can you push down on my hands? Good. And can you squeeze my hands? Good. Can you go like that? Can you push towards me and pull towards yourself? Good. All right. Any pain at all with doing that?
No.
No? Okay. I'll have you stand up for me then really quick. All right. And can you close your eyes and hold out your hands? Good. Okay. Go ahead and open your eyes. Now what I want you to do is walk to the door and back. All right. Any problems feeling off balance or anything like that? No? Okay. You can have a seat. I'm just going to go over a few things with you, okay? All right. So, it sounds like you've been stressed out a lot, too, at home, taking care of your mother. So, I recommend, just taking time for yourself. If you have, any, need for support or anything like that, there's some support groups that are available. You might be able to find someone to, with the same problem as you and, give a little bit of help to each other. Also, I see that you said you like to read, which is good. Keep on doing that if you can, okay? Just find different ways to manage the stress so you don't feel too overwhelmed, okay? Also safety, I'm glad that you're setting an alarm for your medications. It's a very good thing. Keep doing that. Okay. I'll look over a couple of things and see if there's anything more that we could do for you. Okay. And I'll get back to you. Do you have any questions right now?
No.
No? All right. If you think of anything at all, please feel free to let us know.
Okay.
All right. Thank you.
Thank you.